Thank you for listening to Life Improvement Radio. You are listening to a rebroadcast of a previously recorded show.
Good afternoon and welcome to radio's version of Perfection, the Revenue Generating Hour. Mark O'Donnell here, president and founder of RGANetwork.net, a professional business networking organization based in Tampa Bay, Florida, and growing across the land. Who do you know that would be a perfect team leader for one of our groups? Please introduce us with the chiming of the clock. It's 4 o'clock on Wednesday. You're listening to the Revenue Generating Hour on LifeImprovementRadio.com. We're here today with Dr. Schlyer from the Renuvia Medical Center. Good afternoon, Doc, and thank you for joining us.
Hey, Mark. It's a pleasure to be here. I'm excited about being on the Life Improvement Radio. See if we can do a little improvement here.
I'm excited to have you with us. You're a networking superstar with RGA. Jane Ann has somewhat educated us in the art of all things Renuvia. But let's get started with maybe some of your qualifications, Doc. Where did you go to school?
I did my undergrad work in California, and I went to the University of Kansas Medical School in Kansas, which was my home state. And I graduated there in 1980, and then immediately went into a family medicine residency program associated with the University of Kansas in the rural Kansas area. We were trained to be the doctor that you would have seen on the television 50 years ago, that we do everything. We're supposed to do surgery and deliver babies and take care of the common cold and the heart attack. It was really an interesting type of education, and I feel like I've got a really broad spectrum of talents from that to use in helping my patients. I finished my residency in 1983, and I spent 2 years with a clinic in the middle of Kansas, and actually Wichita, Kansas. And I was recruited by a group of physicians in a hospital down in Florida. So in August of 1985, I packed up my little car and I drove to Florida and set up practice, and I've been here ever since.
I like it. I'm from Missouri, so Kansas, you were just across the state. So is that University of Kansas in Lawrence?
The University of Kansas itself is in Lawrence, but the medical school is in Kansas City. Uh-huh. So I actually sat on State Line Boulevard right across from Missouri for the years I was in medical school. So we were really close.
I know. They always say Missouri can't have its own city. We have to share one with with another state.
Truth be known that the Missouri side is probably more exciting than the Kansas side. At least it was when I was in medical school.
And I think the St. Louis, Missouri side is much more exciting. Well, it's much more population than the East St. Louis side. So, Doc, you then got down to Florida. Yeah. And how did you get started with the Renuvia Medical Center?
Mark, actually, it's Renuvia Medical Center.
Renuvia, I'm sorry.
Yeah, not
Renuvia Medical Center. I like it.
I transitioned from family medicine to anti-aging medicine about 15 years ago. I was somewhat disappointed in what I could do for patients just using in-the-box medicine. My patients would come up and tell me, I tried this herb or this vitamin and I felt better. And far be it for me to tell them that they weren't telling me the truth. I said, I believe it. I just, show me more information. I've always been interested in science. Even in middle school and high school, science was always one of the things that kept me focused. I always wanted to know why things work and how they work. I didn't care what people told me. I wanted to see how it worked myself. So, as I mentioned before, I came from the Midwest, but I did my undergrad in California, up north of San Francisco in Marin County. And in Marin County, I was exposed to an incredibly different lifestyle than I was in the Midwest. People were very healthy, a lot of exercise, a lot of changes in the types of food that they ate. I came from meat and potatoes, Midwest, and I moved over to fruit and vegetables and fish and all kinds of different foods in Marin County. I also was involved in school and working in some of the clinics, and a lot of people there told me about the vitamins and herbs and teas that they were using. It was very interesting to me. I couldn't prove one way or the other whether it worked or not, but I certainly didn't disbelieve the people that talked to me. So that was kind of my springboard to take to medical school. And I went through medical school. I had an incredibly wonderful experience. I can't say enough about the University of Kansas School of Medicine. It was a tremendous experience for me. But all through the school experience, I kept thinking, here's what they're telling me that works: surgery, radiation, drugs, you have it. But they don't mention anything about the alternative things that I was experiencing in California. So it's always in the back of my mind, there's got to be some kind of a correlation here that I just have to figure out. As I walked off the stage at the university with my degree in my hand, I was really excited. I said, oh my gosh, I'm a doctor now, and look at all the stuff that I've learned. And then within a second, I had this epiphany, how much that I don't know. I've learned all this stuff in medical school, all the things that you're supposed to do, all the rules and regulations, but I kept thinking about all the patients I'd seen and how much I didn't know about what I could do for them. So that really kind of started me thinking about doing something along with allopathic or the regular medicine to bring some other aspects into it.
I like it. So as we all know, California is ahead of the times when it comes to health and nutrition. So I bet that was an eye-opener, because when you say eat fruits and vegetables and fish, that's kind of common knowledge now, but 15 years ago, nobody spoke about it. So, exactly. So how do you bring this into the practice?
Well, what I try to do is that when I talk to my patients, and I have an initial consultation with my patients, and I sit down and talk with all of them, and the first thing I ask them is, what are you expecting from me? What do you want me to do for you? Some patients will say, I just want my medications refilled. You know, I've been seeing my other doctor for 5 or 10 or 50 years. I just want to see you on a not too regular basis and just fill my prescriptions. Other patients will come in and say, I'm not happy where I am right now. I don't feel well. I don't feel like I'm doing as well as I could. And my other doctor doesn't seem to have any alternatives for me other than just, here, take these medications. And so when we sit down, I'll explain to them, here are the things that I'll do. If you just eat medications, I'm good with that, if that's what your preference is. However, my preference is, let's do everything that we can do for you to improve your life without adding medications or surgery or radiation. Not that we won't use those modalities should we need to, but let's not start with those. Let's start with trying to make you healthier just by what you eat, by what your hormones are, by what your exercise protocols are, about the things that you do, drugs and like smoking and alcohol and stuff like that. Let's see if we can arrange those things to make you feel better. And in that aspect, and I think my patients and I have a good rapport. We understand each other, that I'm not here to tell them what to do. I'm the library. I tell them I read voraciously. I try to get as many different opinions as I can, and I'll bring them back to my patients, and I'll say, this is what I've read. This is what I think is appropriate. You make your decision based on what your opinions are, but here's as much information as I can give you that may improve your life.
I like it. So I have shared your website with our listeners on the Facebook page, the Revenue Generating Hour, and you have a lot of different services, and we're going to cover all of them because we have a lot of questions on Facebook. So can you, I guess one of the questions would say, what is your area of expertise? But it sounds like you're almost a medical guide, is for lack of a better, maybe you have a better answer to that.
That's an interesting observation. Maybe I'm the little Sherpa that carries the bags for you, and I just try to show you the way to get up the mountain so that you survive and that you do well. But I do try to be a source of information for my patients. I try to tell them what things have been tried and true and what things just don't seem to work out. But I want it to be their decision. It's not up to me to tell people what to do. it's only up to me to give them information and help them make their decisions should they require my help.
Here's a good question. How did you choose Renuvia as the name of your medical center?
Well, I had help. My office staff and I have always been family. People don't work for me; they work with me. And whenever I make any big decisions, I always sit down with my office staff, and it's just kind of a free flow of ideas. Here's what we should do. Here's what we shouldn't do. And we were trying to think of a name for the clinic that carried our message to people. So we did Renuvia, via being life, and renew for renewing life. So we try to renew people's lives, and we just thought that Renuvia kind of carried that message well for us, and it kind of stuck.
I like it. So we're here with Dr. Schuyler. Help me pronounce Schlyer.
I'll say the Schlyer part for you.
Thank you. I'm just going to call you Doc. With the Renuvia Medical Center, and you're listening to the Revenue Generating Hour on LifeImprovementRadio.com. We're going to come back with a boatload of questions. I guess people have clicked on services with, so we'll answer everyone's question when we come back. But we're going to talk a little bit more about bioidentical hormone therapy. You have IV vitamin therapy, weight loss, skin rejuvenation, PRP procedures, and then there's a way that you can fill out your patient forms online. So we'll be right back with more of the Revenue Generating Hour after this.
Step into Renuvia Medical Center and take your body back 15 years or even more. Dr. Schlyer specializes in the art and science of anti-aging medicine. Are you tired of being tired? Have you had enough with the fatigue, brain fog, weight gain, and worst of all, loss of libido? Some professionals will tell you this is normal for your age, but we at Renuvia are here to tell you that we do not accept normal. Dr. Schlyer has been the leader in the field of bioidentical hormone replacement therapy for more than 15 years. In addition to feeling younger, Dr. Schlyer will take your skin back 15 years. He is a master at PRP, platelet-rich plasma injections, like the Vampire Facelift, the Vampire Breast Lift, the O-Shot, and the P-Shot. Our goal at Renuvia is to have you, the VIP, the very important patient, looking and feeling your best with our concierge-style care. Come to Renuvia where we put the you back in youth. Call our Tampa office at 888-437-4074.
Welcome back to the Revenue Generating Hour. We're going to kind of jump right into this. We're with the Doc of Renuvia Medical Center here in Tampa. Doc, welcome back.
Thank you. Good to be back.
So first, let's start off because there's some folks in the chat room have asked, and I'll kind of reword there. If you're a medical doctor, they want to know why anti-aging. So why don't you explain to us the difference between sort of traditional and non-traditional medicine?
I will do that. In theory, traditional medicine is based on very strict scientific studies. Those are ones where the investigator doesn't know which client or patient is taking the medication and which one is taking a placebo. Then they collate that information, and then they break the code and decide if the medication was good or not. Unfortunately, most of medicine isn't based on true scientific study. Most of what we see in today's medicine is based on what are called observational studies, where somebody will look at a pool of data and they'll pull out what they think is the reason that data is appropriate. A great case to look at is Ansel Keys. Back in the 1960s, was a nutrition researcher that worked in the University of Michigan. And he published a study that was called the Seven Nation Study. He presented that to the U.S. government in a subcommittee headed by George McGovern. The subcommittee was supposed to find out what was the best diet for people to consume in order to be healthy. And just at that time, President Eisenhower had a heart attack, so a lot of the focus was on heart disease. Ansel Keys came in and said, here's a study that I did of 7 different countries that showed that a high carbohydrate, low-fat diet correlates with low cardiovascular disease. And he gave the senator that study, and the senator said, this looks good to me, we're going to go with that. There were 20 other scientists in the room, and Senator McGovern said, I don't have time, but this looks really good, so we're going to go with this. Unfortunately, Ansel Keys had cheated when he did the studies. He actually had studied 20 different countries. Only 7 of them fit the pattern that he thought was appropriate, and he used that data to change what has been for the past 60 years the diet that the U.S. government has recommended to people. So it was an observational study that was biased by the study person, who's Ansel Keys, and it was totally false. So you have to be very careful when you look at any data. When you do non-traditional medicine, there are a number of scientific studies that are out there, but you have to read them and understand that they may have a difference because of the opinion of the studier, as well as some anecdotal data. And it appears to me that when I see my patients, that if they tell me that they've tried some other herb or vitamin or supplement and they felt better, it's not my job to tell them that it's not true. It's my job to figure out if it is true, would it help other people? So I'm kind of coming from both ends of the spectrum, where I want to believe in the scientific studies, but I also want to believe my clients that come in and other data that I read that shows that a particular protocol or a particular supplement may be helpful to people. And that's kind of taken me into being a traditional physician, which I still do, but doing the anti-aging portion of my treatment, which incorporates a lot of the other data that I've accumulated that says these are things outside what the FDA said are appropriate things, but these are things that are very commonly used around the world and have a significant amount of data supporting that they're not only safe, but very beneficial to my clients. And I try to go with my prime reason for being here is helping my clients, and so I try to go with whatever would help them the most.
I like it. So when you're evaluating a patient, how do you get them to understand what will happen to them if they don't change their lifestyle?
Mark, this may be one of the most entertaining things that I do for my patients in the office. Not that I'm very entertaining, but this is one of the things that we really like to do. I get the information from lab work and from their history and their diet histories and stuff like that, and we sit down and I'll tell them, here's where we are today. In 20 years, you may be sitting in a wet diaper in a nursing home, drooling your cold oatmeal, not knowing who you are, and just wishing that something had happened in your past that would change what puts you in this position. And I tell the patients, I have a time machine. I'm going to go forward in the future 20 years, and I'm going to talk to you, and you're going to tell me how bad you feel and all the maladies that you've accumulated over this 20-year time. And I'll tell you, we can change that together if you're willing to do a little bit of work. And the patient will say, that's wonderful, I'll do that. And I say, I'm going to take you back in my time machine 20 years, but you won't remember me from 20 years in the future. You'll only remember me from sitting in the office. Now let's go back. And I'll say to them, here we are. This is what I propose is going to be your future should you not change the things that you're doing. You have this option now that we can change things together. We can help you not be in the wet diaper, drooling in your oatmeal, not knowing who you are in some nursing home. And I think that when people can visualize like that what the potentials are, both good and bad, that they oftentimes go for the good, and that we can work together then with a more beneficial future for the patients that I treat.
I like it. So one of the questions is, if you're a medical doctor, why are you focusing on anti-aging?
I think that a doctor's job is not primarily to prevent disease. A doctor's job is not to treat disease, I'm sorry. A doctor's job is to prevent disease, to keep people feeling healthy. I don't want to be the person in the emergency room when you have your heart attack or your stroke and you come in and now I've got to try to salvage what I can of your life. I want to be the person who you see prior to that time who says, let's do things so you never have a heart attack. I don't want you to ever have a stroke. I don't want you to lose a limb because of diabetes. I want to prevent disease. And I think if you look at medical communities now, especially in the medical schools, you'll find that to a school, they all try to promote preventing disease because we don't do such a good job of treating it once it's happened.
That was almost like a tweetable moment. So tell us about some of these. You have BHRT. Explain to us what BHRT means.
BHRT is bioidentical hormone replacement therapy. And the theory with BHRT is that most of us were the healthiest that we'll ever be between the ages of 20 and 25. That's where we really peak out. Structurally, neurologically, cardiovascularly, we are at our peak. The other thing that happens at that time is that our hormones are at a certain level that maintain that structure, that integrity. As we age, our hormones start to drop. And as they drop, we lose muscle mass, we lose bone density, we lose neurologic structure. Our heart doesn't work as well, our kidneys don't function as well. A lot of that has to do with time, but an equally amount of this loss of function has to do with our hormones. And if we can replace hormones in people back to where they were when they were 20 or 25, we see a significant change in their physiology. We see people that are building muscle again, not Arnold Schwarzenegger muscle, but muscle of a 20-year-old. We see people that are thinking more clearly, that have a better memory, their cardiovascular function's better, their lipids go down, their blood sugars go down, their endurance goes up, their memories improve, their sex life improves phenomenally. All those things that we miss as we age, from everybody looks back, well, boy, when I was 20, I had a good time. Why should it only be when you're 20? Why don't we physiologically put ourselves at 20 years old and try to enjoy as much as we can at this age as we did at 20 years old? Bioidentical means that the hormones are identical to human hormones. They are essentially human hormones. 30 years ago, we treated diabetics with pork and beef insulin. Then we determined a way to make human insulin with bacteria. So nobody uses the beef and pork insulin in the United States anymore. We use human insulin and actually some analogs of human insulin. But we know that there's side effects to using non-bioidentical products. And so if you use bioidentical, you can get the advantages of the hormone, the benefit of the hormone, without the side effects. And that takes me into the realm of a number of physicians that are out there and a number of clinics that are giving hormones to people that are synthetic hormones. And there's a number of subspecialties that seem to not believe that bioidentical is any different than synthetic. And I'm here to tell you that they're distinctly different, that human hormones are metabolized by our bodies just like we have been metabolizing hormones for the past 500,000 years. But synthetic hormones are foreign to our body, so our body has to figure a way to metabolize those hormones, and there are often side effects to using those hormones that are untoward and that cause people malady that they shouldn't have to experience. There used to be a commercial about butter and margarine on TV, and the catchline was, "It's not nice to fool Mother Nature." And in your health and in your body, the same thing holds true. It's not nice to fool Mother Nature. It's not a wise idea to use synthetic things when you can use natural things that your body is used to.
I'm in.
There you go.
So we've heard about some of those docs that give. So say what BHRT bio.
It's bioidentical hormone replacement therapy.
Okay. So how do you know if you're a candidate?
Statistically, if you're over 25, you have some chance of being a candidate. The older you get, the more likely it is you're a candidate. In men age 40 and beyond, they lose about 2.6 to 3% of their hormones, their testosterone, on a yearly basis. Women know it because they have their menstrual cycles, and they know how they've changed, and they know when they go in through menopause and how they change. Those are very large symptoms. But the smaller symptoms are, is your memory different? Is your motivation different? Are you looking to sit on the couch with your remote control as opposed to going out and things that used to entertain you? Has your libido dropped? I mean, that's a huge indicator that your hormones are down. I have a number of women that I've seen in my office that have come in, and fully half of them tell me that they've seen their primary care doctor, and he wants to put them on an antidepressant because they say that they're just not excited about stuff anymore. They feel like they're looking at the world through a fog, but they don't feel depressed, and they can't convince their doctor of that. And so we do their hormone workup. We figure out what their levels are. And across the board, those women almost always have a hormone deficiency. And once we balance their hormones within 4 to 8 weeks, they're back like they were before all these symptoms started. I have women in tears sitting in my office 2 months after we start therapy saying, why didn't my other doctor tell me this? I feel normal again. And I'm not depressed, and I don't have to take drugs for depression. And I tell them that I learned the same thing that your other doctors did when I was in medical school. It's just whatever your doctor deems to be important in his life to learn about is what he will do. In my life, it was important to have my patients feeling better. And so I did whatever I could do to figure out how I could help my patients without doing the same old thing of giving them an antidepressant. You know, a woman walks in, she's not happy, antidepressants aren't the answer. Figuring out why she's not happy was the answer.
Great advice. I'm excited. We have to take a break. We're going to get to everyone's questions. We're with the doctor. Gosh, we need to come up with something for you, Doc. Renuvia Medical Center's Doc. And we're going to be right back after these messages. You're listening to the Revenue Generating Hour.
Step into Renuvia Medical Center and take your body back 15 years or even more. Dr. Schlyer specializes in the art and science of anti-aging medicine. Are you tired of being tired? Have you had enough with the fatigue, brain fog, weight gain, and worst of all, loss of libido? Some professionals will tell you this is normal for your age, but we at Renuvia are here to tell you that we do not accept normal. Dr. Schlyer has been the leader in the field of bioidentical hormone replacement therapy for more than 15 years. In addition to feeling younger, Dr. Schlyer will take your skin back 15 years. He is a master at PRP, platelet-rich plasma injections, like the Vampire Facelift, the Vampire Breast Lift, the O-Shot, and the P-Shot. Our goal at Renuvia is to have you, the VIP, the very important patient, looking and feeling your best with our concierge-style care. Come to Renuvia where we put the you back in youth. Call our Tampa office at 888-437-4074.
Welcome back to the most riveting hour of the Revenue Generating Hour on Life Improvement Radio. We're with Dr. Schlyer. He is, gosh, there used to be a joke that went around, you never got cured by a doctor because it was a medical practice. If it was a medical perfect, they would cure you and send you home. And I think the Renuvia Medical Center may be as close to as medical perfect as you can get, treating the symptoms. I mean, you said it best in the last segment about, if a woman comes in and she's not feeling up to par, rather than putting her on all kinds of odd medications, find out why she's not feeling up to par and fix it. So, holy guacamole. Doc, welcome back.
Thanks.
So there's a lot of questions in the chat room, and I promise we will answer them if we have to bullet point it at our last segment. Doc, tell us the exciting thing about PRP. What is PRP?
Sure.
We've heard about it, yeah.
Started a long time ago, way before they used it in humans. It started out with racehorses. And, racehorses are $1, $2, $3, $10 million a horse, and if they ever got injured, they were down and somebody would have lost all that money. So what they did is they figured out how to make the injuries of the horse, be it a sprain or a fracture, how to heal much more quickly and much more effectively by injecting platelets into that area. Platelets are little particles in your blood that when they go to an area of injury, they rupture and they release a chemical messenger called a cytokine. Cytokines send that message to the bone marrow and said, we've had damage here, we need stem cells ASAP. And the bone marrow produces those stem cells and sends them to the point where the cytokines were released by the platelets, and those stem cells regenerate whatever tissue was damaged. It's kind of like almost unbelievable, but the stem cells know exactly what tissue they're repairing, and they repair it as such. So they did this with racehorses, and then somebody in the NFL said, well, hey, my fullback is just as valuable as your racehorse. So they started using the PRP on professional athletes, whether it was a fracture or a sprain or a strain. It used to be, and I don't know if you recall from 20 years ago, that somebody had a torn ligament or fracture, they were out for the season.
Right.
Not anymore. Now they're out for maybe 8 to 12 weeks and they're back playing. You think, oh my gosh, how can they do that so fast? Well, it's the PRP, the platelet injections into those damaged areas of tissue that allows them to recover so quickly and so completely. So other physicians, not myself, I stand on the shoulder of giants. Other physicians figured out if we damage tissue and we like when we do chemical peels or we do laser treatments, it causes that tissue to regenerate. Why don't we just bypass damaging the tissue and let's just put the platelets in there and let them bring in the stem cells and regenerate the tissue? And it works phenomenally well. So no longer do you have to have somebody go burn off your face in order to get skin regeneration. You can do it with PRP. No longer do you have to go through incredible surgeries to get your face lifted to some extent. You can do it with PRP. With those injections, we regenerate your tissue to be replacement for the old tissue that you want to get rid of. And it replaces it with very young tissue. When the stem cells go and work, they make the tissue very young and springy and lifelike so that you have a tremendous effect. We've used this in our practice. We do the facelifts, and these were all developed by Dr. Runnels in Fairhope, Alabama. We do the facelifts, we do the facials. I do injections for necks that get rid of the wrinkles in people's necks. There's something called a vampire breast lift where we inject the PRP into women's breasts either because their breasts are too small or because they have loss of tissue around their implants and they're starting to show the edges of their implants. We can do the PRP for that. We have PRP for joints that we use, just like if you're a professional athlete, if you have a bad knee or a bad shoulder or wrist, you can come and see us and we can do that. We have a P shot for men, which has been phenomenal. It reverses the effects of vascular degeneration so that men don't suffer from erectile dysfunction like they used to. And we have an O shot for women that, first of all, it was developed because women have bladder incontinence, and if they cough or sneeze or jump that their bladders leak until their lives just become miserable. But we can use an O shot that regenerates the tissue around their urethra so that they become dry again, they become continent, so that they can go out and do the things that they want to do. One of the side effects of doing the O shot was that women have greatly enhanced sexual response. So if you have incontinence or if you have poor sexual response as a female, you can get the O shot, and it repairs both of those problems. I had a lady who had scar tissue on her earlobes, and she wanted those to look normal again. We've done PRP on that. So there's a wide spectrum of things that we can do. It's an easy procedure to do compared to what surgery or lasers or chemical peels will be. There's essentially no downtime. A couple of our procedures are maybe a day or two downtime minimal, but then you go on about your life, and it has just been phenomenally successful with the people that we've treated.
Okay, so Christy is insistent on me to ask you about the vampire facelift.
Yes. Yes,
Christy.
The vampire facelift, again, developed by Dr. Runnels, who is an incredible guy up in Fairhope. I went up and I trained under him. The vampire facelift is based on the physiology and the anatomy of the face, where we inject the PRP into muscles and subcutaneous fat around the eyes, around the nose, around the mouth and the lips, and it helps to regenerate that tissue so that if you have thinning of the tissue or drooping of the tissue, it does a significant amount of tightening that tissue up and making it younger tissue. And the results have been incredibly good.
Okay, she also says this sounds expensive.
No. The vampire facelift typically runs about $1,500. That includes some filler that goes with it. If you go to a doctor's office for a facelift, $1,500 would be
a consultation.
Yeah, in some cases, yes.
Yeah.
But the nice thing about doing this, though, is that you can go for a facelift, and I'm not saying that the plastic surgeons aren't doing a great job with their facelifts, but they're lifting old tissue. They're stretching old tissue and trying to make it look young again. The volume can change, and the tightness can change, but you can't change the look of the skin simply by doing a facelift. But if you do the vampire procedures, you're not only changing the volume of the underlying tissue so it's plumper and rounder and more youthful looking, but you're making that tissue younger. You're making your 30, 40, 50, 60-year-old tissue 15 years old again. And it's an amazing change that happens with people.
I hope that answered some of the questions out there. So they said, what other treatments have you found to be good for PRP?
As I said, I've had a number of bodybuilders and weightlifters that I've seen that, especially their knees have been very problematic. I've done that with a number of them. I had one gentleman who, actually he's almost 70 years old and has been a power lifter all of his life. He'd had 3 knee surgeries, and he was still in pain all the time. And I said, well, come in, let's try this and see if it works for you. We injected him. He called me back a week later and said he's never felt better. He said he can't remember the last time he didn't have pain in his knees, and he's out running around having a good time now. That's a therapeutic use. The aesthetic uses, the facials, the breast lifts have been, and men don't understand it as much as women do, but if a woman has an issue with what her breasts look like, if there's scar tissue, if there's a change in size from side to side, any of those things, that the PRP does an excellent job in allowing us to make the breast the same size, to get rid of scar tissue. I had one lady who'd had breast implants removed and had terrible scar tissue. It took 2 treatments, but we were able to use the PRP to get rid of the scar tissue and actually give her a little bit more volume in her breast, and she was exceedingly happy with that. I think, though, for the women, the O shot has been, across the board, the most popular, because women that deal with bladder incontinence know, and they don't share that with everybody, but they know how miserable their lives can be. If you can get rid of just the incontinence part, it's a life changer for people. And then the sexual response is even a benefit to that too.
Wow. That's amazing. So this is, I mean, we've heard about this on the news, but I've never, gotten information firsthand. So, therapeutic, you can, like you said, knees. Tell us more about knees, shoulder injuries, stuff like that. That's the other question. So here's the specific question. Could this theoretically replace a knee replacement surgery?
A good question. I would have to say that I'd have to know what was wrong with the knee before I said yes or no. I can tell you there's a gamut of maladies that you can use this with in the knee. Usually knees are replaced when you run out of cartilage. Now, if there's a fracture or a tumor or some lytic lesion, meaning it's bone eroding lesion, you probably have to go to a knee replacement. But if it's simply the loss of cartilage in the knee that's causing significant pain and decreased range of motion and certainly decreased function, PRP would be a wonderful alternative. I tell my patients this too. I just had another gentleman in today that we did his knees, and I said to him, even if I can't prevent you from having a knee replacement, if I can prolong the functionality of your knees for a year or 2 or 3, that's good. And if I can prevent you ever needing a knee replacement, then that's even better. So if people come in that have really severe disease, I try to tell them that we'll do the best that we can, that we'll try to regenerate that cartilage in their knees with the PRP, and that the best outcome is that they never have to see the orthopedic surgeon. if that doesn't happen, usually there's a significant delay and a decrease in symptoms until the time that they do. But it's more the former. Most of my patients never go to the orthopedic surgeon because their knees are better.
Amazing stuff. So we are in awe here with Dr. Schlyer of the Renuvia Medical Center, and we have a lot of questions to get to, but we're going to have to break, so we'll be right back with the Revenue Generating Hour after this.
Step into Renuvia Medical Center and take your body back 15 years or even more. Dr. Schlyer specializes in the art and science of anti-aging medicine. Are you tired of being tired? Have you had enough with the fatigue, brain fog, weight gain, and worst of all, loss of libido? Some professionals will tell you this is normal for your age, but we at Renuvia are here to tell you that we do not accept normal. Dr. Schlyer has been the leader in the field of bioidentical hormone replacement therapy for more than 15 years. In addition to feeling younger, Dr. Schlyer will take your skin back 15 years. He is a master at PRP, platelet-rich plasma injections, like the Vampire Facelift, the Vampire Breast Lift, the O-Shot, and the P-Shot. Our goal at Renuvia is to have you, the VIP, the very important patient, looking and feeling your best with our concierge-style care. Come to Renuvia where we put the you back in youth. Call our Tampa office at 888-437-4074.
Welcome back to the Revenue Generating Hour on Life Improvement Radio. We're going to jump right in with Dr. Schlyer. I'm going to get your name right eventually, Doc. But tell us, there's so much hype about this. Tell us about the IV therapy. We're going to kind of go over your treatments. Tell us about IV therapy, and you had IO therapy, or?
It's IV ozone therapy.
IV ozone therapy.
Mm-hmm. We started doing IV vitamin therapy probably, maybe 8 or 10 years ago. I had read a lot about using IV glutathione, which is a really strong antioxidant that our body swims in when we're kids, and we quit making it as we get older. And I had read that it was effective in Parkinson's disease. So I had a number of Parkinson's patients who were very symptomatic, and we gave them intravenous glutathione. I had one gentleman who had to shuffle in the door, could barely sit down. We gave him the IV glutathione. He sat for 10 minutes, he got up and walked around. And he was essentially symptom-free, but it only lasts for about 12 hours, and then he goes back to his normal symptoms. But in that 12 hours, he got to have a little bit of, a window of walking normally again. And the girls in the office were in tears because he had, we knew how bad this guy felt, and that he had done so well. So from that, I used that as a beginning to start doing intravenous IVs for people with glutathione, but I started adding intravenous vitamin C. Linus Pauling, who is the only man so far that has been given the Nobel Prize twice, was very pioneering in vitamin C therapy. And there's a huge amount of data out there about treating chronic diseases like Lyme's disease and MS, Parkinson's disease, ALS, with intravenous vitamin C. There's actually a couple programs on YouTube about vitamin C and influenza that people ever wanted to look at them, where it actually shows people had life-threatening influenza infections, and they were truly saved by vitamin C. And it's a 60 minutes type programs that's out there that they can look at. Then I started looking at intravenous ozone, which is even better than intravenous vitamin C. Ozone depletion in the atmosphere has bad effects, but if you can use small doses of ozone intravenously, it stimulates your body to make protective elements that decrease the damage that we get from oxidation. And oxidation is the base of all disease. Anything that happens to us is because our tissue oxidizes, degenerates, changes. And using intravenous ozone was shown by the NIH and a number of other very large, reputable agencies to be quite beneficial. In fact, the NIH had an article out saying that the ability of intravenous ozone to regenerate microvascular beds, those are the tiny little blood vessels in your periphery that go to your nerves and your brain and all that, nothing compared to it. There used to be a big push, and still is in hospitals because it's very expensive, about doing hyperbaric oxygen. You don't have to do that anymore. You can do intravenous ozone and get even better results for a fraction of the cost of hyperbaric oxygen. So we started doing the intravenous ozone along with the intravenous vitamin C and the intravenous glutathione. We've had really astounding results with people. I'm surprised. I mean, I see these people and how they look a month, 6 months, and 12 months later, and it amazes me that it was such a simple procedure for them to do so well. Fibromyalgia, lupus, MS, multiple sclerosis, ALS, people that have Parkinson's disease, things that we just typically couldn't treat, and they're actually doing better. Now, this is not a cure for anything. This is a treatment. This is a protocol that we can use to take the symptoms down, to reduce the oxidation, to make people have livable lives where, they can function normally. Lyme's disease is a huge problem, and now we know that there are multiple organisms that cause Lyme's disease. But all those organisms seem to be sensitive to doing the glutathione and the ozone therapy along with the vitamin C. So really exciting things, really astoundingly beneficial things for people. It's not very well marketed because it's not making money for anybody. Drug companies make billions of dollars on statin medications. Think about the amount of money that our country spends over the course of a year on all the medications that are incredibly expensive. But they can't patent this, so nobody's pushing it. So doctors aren't using it very much. I think in the future that it will be more widely used in the United States. It's certainly in France and in Eastern Europe, it's huge over there. They have clinics that are only doing intravenous vitamins and intravenous ozone. So it's a great therapy for people to consider that have chronic disease.
Totally amazing. Holy guacamole. All right, so we're going to get to a lot of them. You also have weight loss. Tell us about your weight loss.
We do have weight loss. We are Americans and we overeat. Let's just be honest about it. But in medical school, I was told that if somebody doesn't lose weight and you put them on a diet, then they're lying to you about what they eat. I never bought that. I said, I can't believe that somebody will tell, here's what I do and here's what I don't do. Well, as it turns out, it's not so much how much you eat, although that has some effect on it. It's what you eat. And there's a huge difference between eating carbohydrates, and if you have another 2 hours, I can give you the pathology and the physiology of it, but let's just say that if you eat carbohydrates, it totally changes your body metabolism. It changes how your body uses fat. It changes how your body metabolizes fat and stores fat. If you are on a ketogenic diet, where you don't take in carbohydrates, but you're using saturated fats and moderate proteins, your body physiology totally changes. I have people that we talk about weight loss, and of course I've been in practice for a long time, and over the course of 5 or 10 years we talk about, trying the diet, and people just, they don't want to change. When they finally do, most of my clients are losing 2 or 3 pounds a week easily just by changing to the ketogenic diet that we give people. I have a YouTube site that I do cooking demonstrations for my patients. So listen, it's so easy to do here. You go to YouTube, you look up Renuvia Medical Center, and look at the videos that we have. That's how easy it is. Mondays in my office are typically busy days because my patients know that I cook on weekends and I bring in my samples for my staff, and whoever's here gets to check the stuff out that we do. So we do a lot of ketogenic cooking, a lot of information for people. It's interesting to note that the ketogenic diet started back in the 1940s and 50s for children that had epilepsy, and it worked very well. And then they came out with drugs that would treat the epilepsy, so they kind of put the diet to the wayside. We're on 3rd and 4th generation drugs for epilepsy now, and the last article I read about a 3rd generation drug said, but it works better with the ketogenic diet. So, we have all these drugs, but in the final analysis, it's a ketogenic diet, 56 years old, that really is doing most of the work for helping kids with epilepsy.
Just amazing stuff. Holy cow. All right. So we talked about skin rejuvenation. Or did we? Bum, bum, bum. That's your PRP procedures, but you have other skin rejuvenation, right?
Typically, our skin rejuvenation is based on either microneedling or microneedling plus PRP. Microneedling has been very popular over the course probably 5 or 7 years. We take a medical grade piece of equipment that has tiny little needles in it, and it runs at thousands of cycles per second, and that we treat people's skin with that. And what it does, it puts tiny puncture marks in the skin, and then the skin responds just like the PRP does. It responds with platelets, and it regenerates the skin from the dermal layer, which pushes the epidermis up and it peels off, and so you get new skin from underneath. It's a very elegant procedure in that it doesn't damage the skin significantly. Right after it's done, your skin is red. But a day later, people think, maybe he was out in the sun, or 2 days later, they don't know if they had anything done. But it does cause the superficial skin to regenerate. And when we do it with the PRP, it really has excellent results to regenerate the skin. Certainly better than chemical peels, and certainly better than doing laser, because both of those have significant downtime. And they're typically fairly painful, and it's minimally painful, if at all, for people that have the procedure done here.
I like it. Holy cow. All right, so we spoke at the beginning of the broadcast about the bioidentical hormone therapy. Kind of give us a synopsis on that.
Yes. The bioidentical hormone therapy is, as far as I can tell, one of the major facets in what we do for anti-aging with our patients. We try to take people physiologically from 30, 40, 50, or 60 back to 20 to 25 when their bodies function the best. And we do that with human hormones. These are hormones that are exactly like our bodies produce, so that we're not fooling Mother Nature, so to speak, that we're actually giving people what we know they do the best on, and no synthetics. And it does an amazing job of making people feel younger, look younger, think younger, their tissue is younger. It really does push back the clock.
I like it. And then the phone or the internet blew up about PRP, I guess the procedure of the future you can get today.
Yes.
What does PRP stand for?
It's platelet-rich plasma.
All right.
We draw blood, we spin it down. I have a machine that uses lasers to read the cells in the plasma, and it selects out. It's called the Buffy coat, which has the platelets, a few of the white cells, and the few stem cells that are in the blood. But it selects that down till we get a very concentrated solution of the plasma with the Buffy coat components in it, and that's what we use to inject. I would say that be careful about where you go. Some offices use a machine that doesn't do nearly as good a job of separating out the Buffy coat. It's a cheaper procedure to do as far as the machine is concerned, but it doesn't do nearly as good a job. And you also need to be careful about going to people who do PRP that weren't really trained in doing it. I mean, there are videos up on YouTube that show procedures, and I'm sure there are doctors out there that will go to the YouTube site and say, well, I can do that in my office because I'm a doctor, and go for it. So just be cautious and find out what are the credentials of the person that you're going to, where did they train and who trained them. And I'll tell you that Runnels was pretty much the godfather of PRP, and if you can find somebody who was trained under him, I think that's a reasonable person to start with.
So, Doc, if someone is listening and says, I'm in, how do they get in touch with you?
We have, is our number up on your site?
It is.
They can go to our website, Renuvia Medical. We can give the number out over the air if you'd like to. It's 727-847-1825.
I like it. We
schedule people, and usually it may take a week to schedule what we need to do for you, but there's no long waiting here. We work around our patients.
And then how much is a consultation is the last question here.
Well, it's exceedingly expensive. I don't charge anything for them.
What?
My consultations are free. No, I don't charge anything for consultations. I want to talk to people who want to talk to me. I want people to understand I'm not here, I'm not charging you $500,000 a consultation or whatever the going rate is. I want you to meet me, and I want to see if we have rapport, and I want to see if we can work together. And if we can, then that's great. And if we can't work together, if one of us is unhappy, then why should anybody pay out of pocket for that? No, I don't do initial consultation fees.
So Renuvia Medical Center is the name, and health and wellness is your game. I like it. So, Doc, thank you so much. I mean, what a piqued interest here, from bioidentical hormone replacement therapy to IV therapy to what was it again? Ozone. Wow. So it's worth a conversation with the doc, and you can't beat the price for our listeners. Give them a call, set an appointment. We're going to definitely get the doc on our speaking circuit. You can visit his directory listing at rganetwork.net or go right to their website. It's Renuvia, RENUVIA medicalcenter.com. And there's a plethora of information. Doc, thank you so much. I mean, I don't think we've had this many people ask so many different questions in a long, long time. So it's been an ultimate pleasure. We appreciate you and your support of small businesses in the Tampa market. Do you have any final thoughts? Eric is signaling me, so
that we have to leave.
Well,
I just want people to know that I don't consider what I do to be anything special. I want to help people to help themselves. I just want to be a source of information. I would like at some point in my patients' lives, is it 6 weeks from now or 6 years from now or 6 decades from now, to think back about what we did together and how good they feel, and maybe have a little smile, say, I'm glad that we got together. And I hope that I can do that with other people.
I like it. Well, on behalf of the Revenue Generating Hour, Life Improvement Radio, the good doc here, make that call tomorrow and introduce yourself to the doc. He's waiting to meet you. Good night, everyone.
Thank you for listening to Life Improvement Radio. The views expressed by show hosts or their guests are their own and shall not be construed in any way as advice from Life Improvement Radio. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our website. Personal perspectives expressed by the producers, writers, or editors will always be presented as such. Any rebroadcast or retransmission without the expressed written consent of Life Improvement Radio is strictly prohibited. Thanks for listening.